I'm Dr. Shah, one of the ophthalmic surgeons working in Glasgow. I like to demonstrate you how to rescue Capsulorhexis Radial tear out using a cystotome on IC cataract surgery simulator. I will also show you the technique carried out in a human eye.
IC is a sophisticated simulator designed for intraocular surgical training. During simulated surgery, the surgeon manipulates realistic handheld instruments that are inserted into the artificial eye. The motion of the instruments and the orientation of the eye are picked up by highly accurate sensors and transmitted to a computer, which renders the virtual operation scenarios into the IC microscope. In the next video clip, we would like to demonstrate a technique of rescuing Capsulorhexis Radial tear-out using a cystotome in the IC surgical simulator. In our technique, first unfold the rhexis flap, then tilt the needle tip horizontally to avoid puncturing or cutting the flap. Engage the needle on the flap, but avoid placing it too close to the point of tear. Gently push or pull the flap to the center of the rhexis. Re-engage the needle on the flap when the direction of tear starts to do a U-turn. Then complete the capsulorhexis in a normal fashion using the cystotome,